Hello, my name is Victoria. This is my video reflection and analysis of completing an advanced care plan with a friend. In this video recording, I'll reflect on my experience and learning in creating the advanced care plan. I will reflect on how my learning from creating the plan may affect my future practice as a nurse. And I will discuss what I've learned about myself from the experience of the advanced care plan and my perception of the importance of advanced care planning. So, for my experience with advanced care planning, I was with a friend in an informal setting. While it was a friend I'm close to, it was definitely awkward and uncomfortable. If I were to repeat the experience, I would do the workbook with someone I am not close to, or if possible, someone I don't know, just to see if the experience would be different. The experience may be different if I did it with someone I didn't know, because as a friend, it was hard to remain non-judgmental and professional due to some answers being shocking or new information and my relationship with the person I was asking the questions to. This experience caused me to reflect on a real setting. According to Boscart McCleary and Takar 2023, advanced care planning is intended to be planned before a person is unable to make decisions for themselves and involves a substitute decision maker who will aid in decision making based on the person's wishes. So for myself, my substitute decision maker would be someone I love and trust, such as my future husband or my sister. Or reversely, I could expect to possibly be their substitute decision maker. So if the advanced care planning were to be completed between my sister and I, like, would I be able to honor her decisions? Could she honor mine? Would I be able to be truthful about my wishes? Would I change my answers, or would we avoid upsetting one another? Everyone has different values, beliefs, and thoughts when it comes to death and end-of-life wishes. Individuals have different feelings on what is important or necessary in feeling they are living or life is meaningful. So as a future nurse, I want to grow in being able to push my personal feelings aside to optimize my patient's autonomy and decision making, and I want to be able to recognize this between a patient and a family as well. From this experience, I learned advanced care planning requires more time, knowledge, and effort than just sitting down at a table and asking questions from a booklet. When I was asking the advanced care planning questions, I felt I would not know how to answer the questions myself. The questions could be interpreted differently, and if there was a lack of knowledge on what the questions are asking, then a person's true wishes and goals might not be met, or they could be misinterpreted. The advanced care planning experience with a friend was spontaneous and done in a short period. So there was no previous talk or education done before the advanced care planning questions were asked. So for the person I was asking the questions, that's a disservice because the answers may not be true. It was just brought up on the spot without any background or relevant information to understand even the questions being asked. So for future practice, I would take suggestions from Garland and Heckman 2020. The authors suggested to have advanced care planning discussions arranged and organized in advance. Before the discussion, I would want to ensure the client and patient knew their own medical status and their own values and goals towards their medical care. Having pre-planned discussions can allow the person to reflect on what is important to them. So that helps make sure that their goals are their goals and maybe not someone else's. Additionally, I would take suggestions from Heckman et al. 2022 to be prepared to take the time to conduct advanced care planning properly. So I would need to take time to establish trust and an open relationship and open communication. I would need time to educate them on things that they don't understand, possibly what life measures are or life-sustaining measures are. The person I'm asking in my future practice, they might not know what that is and need clarification and understanding. I would need to have time to have open discussions with the client and understand their needs. Sometimes even just the discussions between a nurse and their patient could help the patient flow their own ideas and understand what they value and what they would want as their end-of-life goals or what they would like in their advanced care planning. A nursing competency outlined in the College of Registered Nurses of Alberta, CRNA, 2019, says as nurses, we should support and empower clients in making informed decisions about their health care. So taking the time to ensure all the client's needs are met from the education to discussion will allow myself as a nurse to provide client-centered care and ensure the client is making the best decisions for themselves because they are informed and understand their own situations, values, and beliefs, their own health status, and possibly having family they need there to make the decisions. So from this experience, I was able to recognize my own discomfort with death. I recognized how I'd be unsure of how to answer the questions and equally be able to ask in a real healthcare setting with a patient. I have high beliefs of the importance of autonomy for patients in healthcare, and advanced care planning is definitely part of a patient's autonomy. So I learned I could benefit from taking time to evaluate my own personal thoughts on death or wishes for myself regarding death. Bouchal and Moulis, 2018, they emphasize that the ability to reflect on our own beliefs, values, and attitudes about sensitive topics like death and advanced care planning can directly affect our ability to provide best care. So if I have personal awareness on the topic, it may help me feel more comfortable in the future when the topic's brought up in general and be able to properly aid my patient in drawing on their own goals and equally be able to push my own feelings aside. Being able to push my own feelings aside is another nursing competency of being expected to understand our own influence on a patient or client and aim to reduce our own bias and reduce influence on their decision making. CRNA 2019. Since advanced care planning is a critical component of a patient's autonomy, I would want to be as prepared as possible, and having my own personal values and comfort sorted out is step towards that preparation. Creating the advanced care plan changed my perception on advanced care planning. I feel like I have underestimated the complexity and uncomfortable nature of it. Like I said earlier, it's not just sitting down at a table and asking someone questions, and that's that. I think I have always believed it's important, but I never explored the depth in what it entails and how important it will be in my nursing career. And I've never recognized the growth I need towards death and advanced care planning as a whole. This assignment forced me to reflect on my current understandings and feelings toward advanced care planning and end-of-life wishes. I really would like to take my reflection into my clinical practice and practice as an undergraduate nurse if I have the opportunity, and grow on my ability to deal with death and planning for end-of-life wishes, and hopefully be part of an advanced care planning scenario so I can just grow altogether.